For Amendment number 11 by Rodriguez.
Chair recognizes Senator Rodriguez to explain the amendment.
Thank you, Mr. President and members. One of the reasons, yet again given to justify nearly all of the major elements of this bill has been that women deserve better quality care. The assertion made by supporters of this bill is that many existing facilities provide substandard care. If that is the case, then I would hope that you will support the amendment in front of you now. The amendment addresses issues that have come to light during the last several years with regard to crisis pregnancy centers. In 2005, as you may remember, those of you who were here, the legislature established a funding stream for CPCs, as these crisis pregnancy centers are referred to, and specifically excluded comprehensive family planning providers from eligibility. To date, although they have received over $26 million from the state, CPCs are not subject to any oversight or licensure requirements. While some CPCs may provide appropriate support and information to women facing unintended pregnancies, many do not. A number of studies, including a congressional investigation by Congressman Waxman, indicate that many CPCs intentionally misinform and mislead women seeking pregnancy-related information with the intention of dissuading them from exercising their constitutional right to choose. No matter how a person feels about the question of legal abortion, members, we can all agree that women should never be misled when seeking information about pregnancy, birth control, abortion, or sexually transmitted diseases. Texans have a right to honesty in advertising and truthful information about their health care options, and these CPCs should not be exempt from this basic principle. Accordingly, members, this amendment requires information provided by CPCs to be scientifically accurate and evidence-based as determined by medical professions. Second, for CPCs that receive state funding, the CPC must provide comprehensive, non-directive reproductive health care counseling and information, including information on planning, birth control, pregnancy, and postpartum health. And finally, CPCs should be required to display an 8.5-inch by 11-inch sign that states the CPC is not a licensed medical facility. Taken together, these provisions will help improve the standard of care at CPCs by ensuring that women receive comprehensive, medically accurate information. In addition, members, we can assure Texans that their taxpayer dollars are being spent on services that improve women's health care in this state, and I believe that's what we've been talking about here all day today. Mr. President, I move adoption.
Thank you, Senator Rodriguez. The chair recognizes Senator Baker on floor Amendment 11.
Thank you, Mr. President. Thank you, Senator Rodriguez. In reading through the amendment, this is the first time I've been able to see this, but I have a little concerns. We talk about the exact size and the font size of a sign, as well as the Attorney General and District County Attorney in the civil penalties, and then most importantly, the Deceptive Trade Practice Act and how that applies into this bill, which nothing in this bill is dealing with the Deceptive Trade Practices Act. And so I think that this amendment, though I understand and hear your intent, I think it's a little overbroad, and with that, in all due respect, I'd ask that we table floor amendment number 11.
Chair recognizes Senator Rodriguez to close.
Thank you, Mr. President. Senator Hager and members, this is all about providing accurate, scientifically evidence-based information to women who find themselves in a crisis situation with an unplanned pregnancy. That's why they're called crisis centers. And it seems to me ridiculous for us to say that we want to regulate the abortion clinics, the family planning centers, and as we regulate the ambulatory surgical centers in order to ensure that women have a safe setting for abortion procedures. And yet, for these crisis pregnancy centers, we are willing to tolerate misleading and inaccurate information. And in fact, we all know, I know you know, that these crisis centers, many of them, not all of them, as I said, but many of them, provide this misleading information with the goal of dissuading women from being able to exercise their constitutional right of electing the choice to obtain a legal, safe abortion. And that's what some of these centers are up to. And they're getting funded with our taxpayers' dollars. Dollars, by the way, that were taken away from the family planning centers. So it seems to me that if we really care about how our tax dollars are being spent on improving women's health and in promoting safety and the welfare of women, that we would be supportive of providing more regulation for these centers. So with that, members, I ask you to support voting against the motion to table.
Thank you, Senator Rodriguez. Members, the issue before us is the motion to table by Senator Hager, opposed by Senator Rodriguez. The Secretary will call the roll.
Birdwell, Campbell, Corona, Davis, Jewell, Duncan, Ellis, Eltife, Estes, Frazier, Garcia, Hancock, Hager, Hinojosa, Huffman, Lucio, Nelson, Nichols, Patrick, Paxton, Rodriguez, Schwertner, Sulliger, Taylor, Uresti, Vandepute, Watson, West, Whitmire, Zaffarini.
Members, there being 19 ayes and 11 nays, the motion to table is sustained.
Thank you, Mr. President. Senator Hager.
Thank you, Senator Rodriguez. The chair lays out floor amendment number 12 by Senator Vandepute. The Secretary will read the amendment.
Floor amendment number 12 by Vandepute.
The chair recognizes Senator Vandepute to explain floor amendment 12.
Thank you, Mr. President. Mr. President and members, in looking at the bill, we have all really committed ourselves to try to reduce the amount of unintended, unplanned pregnancies. For the past decade, though, Texas ranks #1 in the United States for repeat teenage pregnancy. You know, we like it when we're ranked #1 on jobs and we're ranked #1 on the economy or when our sales tax is up. But it's not a great distinction when we're #1 in repeat teen pregnancies. We've done a better job on teen pregnancies. I think now we're hovering at about 3 on teen pregnancies overall. But the saddest part is that we are #1 with repeat teen pregnancies. In fact, 22% of teen births were to teenagers who already had at least one child. While the teenagers are trusted to make all the medical decisions for their children, they are still unable to obtain family planning without parental consent. Only about, and our statistics, as we've learned in both in Health and Human Services and in the Education Committee, we know that only about 40% of teen moms will finish high school. And that has a very strong repercussion for women and their children. And only about 10% finish any sort of 2-year college program. The sad thing for our budget, Senator Hager, is that 1 in 4 of these moms will go on to need TANF or welfare. And within 3 years of their children being born. The repeat teen pregnancy makes already a tough situation more difficult, and more difficult for the mom to have any sort of vision of a life with dignity. Children born of teenage moms have a higher risk, as you know, for lower birth weight and infant mortality. They're more likely to have medical problems. And unfortunately, they're also more likely to be placed in the state's foster care. Our state, the recent statistics is we spend $1.2 billion in Medicaid funding to teenage births alone. So this amendment would prevent the provisions of going into effect unless we allow teenagers 15 to 17 who have already had one baby be able to obtain family planning or contraceptives without parental consent. Members, I was in the House when we did the bills on parental consent, both on abortion procedures and on access to contraception. And the idea then is it's really good for parents to know when their teenagers are sexually active. But if your teen already has had a baby, you can assume that she's had sex at least once. And so what this amendment does is that it makes sure that if we're really talking about health of the woman and reducing the need for abortions, then the way to do this is not to make abortions inaccessible, but to make them unnecessary to begin with. Part of that would allow teen moms, 15 to 17, who already have just one baby, that they would be able to access contraception and family planning. While Texas trusts the mothers of these children with all medical decisions about their children, they still make them get parental consent to go get family planning. And so this is the amendment is just a precursor to allow it. That the provisions don't go into effect until we have our teen moms being able to access family planning without consent.
Chair recognizes Senator Hager on floor Amendment 12.
Thank you, Mr. President. Thank you, Senator Van de Putte, very much. This amendment, one, I'm not sure if it's germane to the bill, but instead of asking a point of order on it, I do not believe that this bill, even though I do agree we don't need to be proud about number one in teen pregnancy, and we want our youth to stay in school. We want them to have successful, productive lives, and I absolutely agree with you in that. But I don't think that this is the proper place to have the discussion on this bill, and I would ask that we table this amendment. But thank you, Senator.
Chair recognizes Senator Van de Putte to close.
Thank you, Mr. President. Thank you, Senator Hager. And I appreciate the members of this body listening to me on this, because for any woman to have to make that decision to terminate a pregnancy, this is probably the most difficult decision that they ever have to make. And we all agree that we want to reduce the need for abortions. One way we could do that is to make sure that our teen moms can actually get family planning services without having their parents consent. I know that we all want to reduce teen pregnancy. I brought this amendment because I thought it might be good public policy. I had a bill like this 2 sessions ago, and I was able to bring it to the floor, but I could never get the support to pass. So I know what the outcome is going to be. But for proponents of this bill, if you really mean what you say about trying to reduce abortions, then let's come back next session and do the type of policies that make abortions unnecessary in the first place. I respectfully ask that you vote no on the motion to table.
Thank you, Senator Van de Putte. Members, the issue before us is a motion to table by Senator Hager, opposed by Senator Van de Putte. The Secretary will call the roll.
Birdwell, Campbell, Corona, Davis, Duell, Duncan, Ellis, L-Type, Estes, Frazier, Garcia, Hancock, Hager, Hinojosa, Huffman, Lucio, Nelson, Nichols, Paxton, Rodriguez, Schwertner, Seliger, Taylor, Uresti, Van de Putte, Watson, West, Whitmire, Williams, and Zaffarini.
Members, there being 19 ayes and 11 nays, the motion to table is sustained.
Thank you, Mr. President. Thank you, Senator Hager.
And thank you for your passion.